Hi. The second continuation of our first video on PTR with Dr. Veeresh. The second question, first question here is: so how many hours after knee replacement can the patient start walking?
Right. So, as I said, with our modern techniques and modern anesthesia, we are able to make the walk patients on the same day of the surgery at the earliest. So, if I operate my patient in the morning at 8 a.m., I will be able to make them walk by 2 p.m. in the afternoon, as early as possible.
So
once the
less than 24 hours.
less than definitely less than 24 hours.
Because many people have this misconception that after surgery I am depending on the bed for 2-3 days.
Not true.
So
Not
walk
true.
within 24 hours.
They will be able to walk within 24 hours and they will be able to use the toilet by day 2.
Okay. And after, suppose you do some knee replacement, whether your surgery matters more or physiotherapy matters more for the patient.
Both are equally important.
Okay.
So definitely surgery has to be perfect. We should get a good alignment, good implant position, as well as soft tissue balance.
Okay.
And definitely post surgery,
Okay.
the physiotherapy is also very crucial. The patient has to participate in the physiotherapy to get good outcome, that is full range of motion.
Okay.
And to be able to walk without any support.
Second thing you told about the alignment in surgery. So in that sense, is all patients has to undergo robotic knee replacement only, or otherwise also okay?
Not true, not true. So
Otherwise, who should go only for robotic, or else if everyone robotic is better for everyone, or somebody can offer not to go for robotic?
So robot has been there now only recently from last 4-5 years. So what the robot does is it helps us in putting our implant in correct position more accurately with more good precision.
Okay.
And then we say the recovery is faster, the pain is relatively less compared to the conventional surgery. So there are definitely few indications where robotic is needed, like previous fractures, if they have an implant around the knee, if they have a nail inside the bone. So there are few indications where robotic will be the best indications to be done.
Okay, okay.
As such, it is not compulsion that all knee replacements need to be done with a robot.
So who recover faster? Like, you suppose it was operate some 10 people. Okay, as per experience, who recovers faster and who takes more part? Suppose somebody is physically active,
Right.
and other things,
Right.
and some people are sedentary, obese. So those are the broad categories.
Yes. So I see different sets of patients. So those patients who are physically very active even before the surgery, those who have a low BMI, like means healthy BMI, and then those who are physically active, they recover faster because their muscle strength is very good. So that muscle strength is very important post surgery. So we have seen those patients who are relatively more fitter, more younger, more active, recovering faster. So that doesn't mean that the fat people don't recover. They do recover. What they need is more of a motivation post surgery to participate in the rehabilitation. And once they participate and do their physiotherapy sincerely, they also do fairly well.
So after TKR, so this takes 4 to 6 weeks
Yes.
to comfortably walk.
Yes.
So any patient should take some more time, or any patient can walk a little bit less time.
Yeah. So on an average, most of the patients will walk without any support by 4 weeks. Yeah, there are few patients who may need a little extra push and who may take a little longer time, like very obese patients, uncontrolled, and those patients who have never exercised in their life may take a little more patience, but definitely younger, fitter patients, I have seen them walking without any support even as early as 10 days to 2 weeks.
Suppose some patient, some person has both the knees osteoarthritis, both the knees need to take care. To advise them to go together in a single setting, single operation, or one after the other.
Yeah, so there are few criterias which we follow when to decide whether patient can go ahead both the knees simultaneously or they have to stage it. So if a patient is relatively young, what do I mean by relatively young is if they are around 60-65 years with only one or two comorbidities, definitely they are a candidate to go ahead with simultaneous knee replacement. And if they are above 70 or around 75 and they have one or two comorbidities, usually I will advise them to go ahead with staging. So do one knee first, and then after a few months they can go for the second knee.
Okay. So anything else you can tell your audience? Suppose if I miss something in the questions.
Yeah, so definitely knee replacement surgery is a very safe procedure now. So with the advent of modern techniques like robot, and then with the definitely about pain relief, I would like to say here, most people fear about the pain post surgery. So our pain specialist here do a lot of things here to reduce the pain, like regional anesthesia. We give nerve block, and then we give injections around the knee during surgery, and post surgery also we give medications through the nerve block. So the pain control is very good now post surgery. And then I would like to tell your audience that don't fear the surgery. If you are suffering from severe arthritis, definitely total knee replacement is a very safe and helpful surgery to undergo.
Thank you, Veeresh. So thank you, and Dr. Veeresh worked with me in Manipal Kanakpura Road. And if you have any questions, please put in the descriptions below the video, and we'll be happy to answer anytime. Thank you.
Thank you.